Hi, this is Dr. Bruce Cardone. I am back again. As part of this website, we're trying to make this as realistic as possible. So what we're doing is we're actually gonna record a session of superficial sclerotherapy. We're very fortunate to have Chris here, who volunteered to help us. I have also my assistant, Kim, who works with me. And again, I'm very fortunate to have an assistant. A lot of people, a lot of physicians do this without anybody in the room, and I'm very lucky to have her. So I just want to begin by saying it's always good to have some type of magnification. And what I do is I use a helmet, and this what this does is this allows me various degrees of magnification. Right now, it will provide 3x magnification, so that I can see much better. I can increase the magnification, but when you do that, you end up getting too close to the patient, and it makes the patient a little uncomfortable, and it also is it also just makes the job more difficult. So in any case, I have 3x magnification. This also polarizes things and it also allows polarization of the veins, so I can see them better. So in any case, that's my discussion on that. And so I put my helmet on, and then I just have to get ready and focus in with the patient. So with sclerotherapy, what I usually do, and the way I'm going to do this is exactly how I would do it with any patient. It's the same thing each time. Basically, what I'm using is polydocanol, which is a detergent-type solution, and what this does is it destroys the lining of the vein, the cells, and eventually they die. They clot on the inside, and then they die, and the body reabsorbs them. In any case, so I'm using polydocanol, and I have these little needles. My needle, I have a 30-gauge needle, so it's very tiny. I'll just show you what we're doing and how we do it. And on her left leg here, I've got a bunch of veins, and basically we're going to try to focus in on this. And what you can see is that I go into the vein. Sometimes what I do is I go through it, and as I'm coming back, I go through it very slowly, and as I'm coming back, the vein, you can see, disappears. Now what will happen is these veins will initially disappear, and then they'll come back, they'll clot off, they'll be visible, but after that they'll begin to begin to die, and at that point the body will reabsorb. So you can see what I'm doing here, and as I do this, the veins themselves are disappearing. Just look at what we've done, and a lot of times there are veins that are old, and they're filled with a little bit of hemoglobin, a little bit of blood, and we just poke those with a little needle. Perhaps we can get the vein line and bring it somewhere and put it in. Yeah, this is just, I'm just poking it with the needle that I did for injections. And then you just try and squeeze some of the old blood out. And it just helps. A lot of times these things heal faster, and certainly the degree of pigmentation is decreased dramatically. And then I use a vein light, and you can see, I don't know whether the camera picks this up, but with the vein light you can see everything much better. Using a 21-gauge needle, first I tell the patient that it's going to sting and not to swing, and a little poke, little tiny poke, little poke, and I go right through them, and then I usually put the needle back in the thing that's filled with a little alcohol, and we try and squeeze a tiny bit. And again, we're squeezing the residual heme out. Okay, I think we're done, and we're going to move on to another patient. Okay, anyway, all right, this is another one of our patients, Randy. and Randy had a bunch of stuff done. You know, most guys don't get their ankles treated or get any type of superficial. He's elected to do this because he's an avid lake person, sports enthusiast. He's always out there. He doesn't want to show people these ankles. You know, that's his reasoning. So who am I to say no? You can't be my patient. And these are kind of nice. They hurt like heck to get through, but it's so nice when they go away. You know, it really helps to have somebody here, and your patient needs to be completely informed that this is going to hurt. The other thing about doing the ankles is that you know, the ankles are more dangerous than other areas of the lower extremities to do sclerotherapy, because there's these little micro communications in the ankle between the superficial and deep system, and so there's a more likely it's more likely or more possible to get a deep vein thrombosis, and or DVT is the acronym for that. You know, those can be obviously very dangerous. We tell everybody, and the other thing that it's often happens is swelling. Swelling occurs a lot. I've actually never gotten a deep vein thrombosis from this, but a lot of the patients get swollen, you know, sometimes significantly when you do this. So anyway, so just put some thought into it and consider when they decide to have this done.